Hello, my name is Jon Emery, and I'm going to be talking to you about the breast cancer risk prediction reports that are produced by CanRisk. So the risk categories in the report are based on NICE guidance, as summarised in the table here. Importantly, there are two different measures of risk: the risk of developing breast cancer between the ages of 20 and 80, and the risk between the ages of 40 and 50. And whichever is high is the risk category used to inform the CanRisk report. This demonstrates the proportion of people who are at higher risk, showing that only about 17% of the overall population will be in either the moderate or high risk group. We use multiple formats in the CanRisk report to present information about risk and how that risk changes over different time frames. And this is a way of improving the way that people can understand this risk information by presenting it in a variety of different ways. You'll be familiar with communicating risk of other conditions in your practice. For example, this comes from the CanRisk score, estimating risks of heart attack or stroke, and again uses multiple formats to aid the way that you can help communicate this risk information. The CanRisk report is broken up into three sections. The first is predominantly information for your patient, and the sections 2 and 3 provide more specific information relevant to healthcare professionals. And I'm going to talk now through a moderate risk report as an example. So this section presents risk information around breast cancer in a variety of different ways. So here it presents the 5-year risk in both a percentage as an odds, and then the graphic on the right is called an icon array. And similar formats are used to present risk of, over the next 10 years and risk from 20 to 80 years old. This graphic presents comparative risk information, so of the individual's risk estimates compared to the rest of the population, and how that risk changes over time, with the red dots relating to the specific timeframes that I've already discussed. This uses the icon array format to present this similar comparative risk information. Section 2 then presents, again, a different way of showing this risk information and how it relates to the NICE risk categories, with the orange box representing the moderate risk group. The table then presents information both for the individual and compared to the general population, and how that risk increases over time. This section within section 2 talks about the risk of carrying an inherited pathogenic variant. So a variant in one of the genes listed on the right that are associated with increased risk of breast cancer. It frames it positively, so the risk of not carrying a variant in one of these genes, bearing in mind that you need about a 10% risk of carrying a pathogenic variant in one of these genes before genetic testing would be offered by the genetic service. And the table on the left just summarises the individual probabilities of carrying a variant in one of these genes. Section 3 presents more detailed information about the risk factors that have been used. This summary here is of the pedigree of the family history information. This table summarises the additional risk factors that have been accounted for using UK and cancer incidence rates to estimate breast cancer risk. And then finally, this provides information around the breast cancer polygenic risk score that is accounted for multiple small genetic changes that we know are associated with breast cancer risk. The graphic on the left demonstrates the population distribution of polygenic risk and where the individual woman lies on that distribution. And on the right is a different way of presenting that same information, showing that only 4.9% of people in the population would have a higher polygenic risk score than this individual. It's important to note that the current polygenic scores are calculated on data from European ancestry populations, but this is currently being updated by the CanRisk team to represent a broader range of ancestries. And so that summarises the risk information presented in the CanRisk report.